Many of you may have seen articles like this recently, and as physician shortages only continue to grow, and as insurance becomes more expensive and less obtainable for many Americans, novel ways like this will continue. But how did this start? The healthcare system in the United States faces a growing crisis with physician shortages. The Association of American Medical Colleges projects a shortage of up to 122,000 physicians by 2032, with primary care being the one of the most impacted specialties. And this shortage disproportionately impacts rural and underserved area where healthcare providers are already scarce. And in these regions, patients often face long travel distances and extended wait times to see a doctor, exacerbating the health disparities that are already delaying essential care. Health deserts, which are areas with limited to no access to primary healthcare providers, are particularly problematic for women's health. Approximately 19 million women live within a healthcare desert of the United States, further emphasizing the need for innovative solutions to address gaps in care. It's estimated that nearly 90% of the US population lives within 5 miles of a pharmacy, making pharmacies one of the most accessible healthcare touchpoints. In contrast, accessing an OBGYN often involves significant barriers, including long wait times that can range from several weeks to months, especially in rural and underserved areas. One novel care mechanism is allowing pharmacists to prescribe contraceptives, like we're seeing in many states. This doesn't mean that birth control is over the counter, except for Opill, or even behind the counter and you just have to sign a form. Instead, you're going to have an appointment to get birth control just like a normal doctor, but now your appointment is with a pharmacist. But pharmacists prescribing contraceptives can address significant gaps in care created by long wait times and shrinking resources. By enabling pharmacists to step into this role, communities can gain access to essential healthcare services more efficiently. Additionally, healthcare deserts in rural and in underserved areas exacerbate disparities in women's health outcomes. Pharmacists are readily available healthcare providers in many communities and uniquely positioned to help bridge this healthcare gap. More pharmacies adopting services like contraceptive prescribing, women can access the care that they need without the hurdles of scheduling appointments or traveling long distances to see specialists. This model not only reduces barriers to access, but also ensures that individuals can obtain necessary medications without delays or costly fees. As the healthcare landscape continues to evolve, policies like this that support pharmacists in prescribing medications like contraceptives will play a crucial role in improving our public health outcomes. Addressing physician shortages and creating accessible pathways to care are vital steps forward in creating equitable healthcare for all Americans. Join the chat. What other services make sense for pharmacists to perform? What other medications, vaccinations, or services are you looking forward to in the future?